Hi Chris.
Hi Lucy.
Thank you for joining me at today's June Integrated Care Board. We are in a lovely, very wet and cold part of St Austell, and it's lovely to speak to you today and give a bit of a summary of what's happened at today's board meeting. Could you tell us your name and title and explain what that does for the ICB, please?
Yes, so I'm Chris Reid. I'm the Chief Medical Officer for the ICB. The Chief Medical Officer works really closely with the Chief Nursing Officer just to make sure we have a focus on clinical quality. We have a focus on our population from a population health, and we try and make sure we address the equity element as well, which is so important.
And not only are you a part of the ICB, but you're actually also a practicing doctor locally. And where do you work in Cornwall at the moment is it 1 day a week?
So yeah, on average, I'll try and work 1 day a week. So sometimes it's a bit less because this work is quite busy. But I work down at West Cornwall Urgent Treatment Centre. So it's a great place to see that interface between what goes on in the community and what goes on in our hospitals as well.
And being actively embedded that way is really useful in your work, I take it.
Absolutely. So I think it's something that's really important. It's just making sure you find the time to keep sort of your clinical experience going.
And is West Cornwall Hospital pretty busy when you're down there?
It's always busy down there, and of course it's getting busier because as part of our plan to make sure patients can be cared for closer to home. I think providing services closer to home is such an important thing, and we know that takes the pressure off our acute hospital, so that's there for when you really need it. But having a service like an urgent treatment centre in the community, and with our sort of how we deal with frailty in the community, is I think an exciting way forward to help ensure we deliver services in a timely way closer to home.
Definitely, and I know it's a bit of a flagship hospital building and facility for local people. Open every day, 8 till midnight, which is great to see. And I know there's plans under discussion at the moment to extend that to 24/7 model. So we'll keep our colleagues and our staff and public updated on that as things emerge on there.
Absolutely, yeah.
And I suppose that really links nicely into some of the performance data that's been discussed at board today. We've seen a big improvement in a number of areas, in particular providing services locally for our community. In particular, we talked about planned care as well. Can you explain what planned care is and what we're doing here in Cornwall that's so different and making a difference?
So planned care is the opposite of unplanned care. Unplanned care, an emergency, we've got to do something about it. Planned care, and a good example is if you might need your hip replaced. So you might need there's a planned elective surgery that'll happen. And we saw, didn't we, in the story about a gentleman who's been waiting a long time for a hip replacement, but we're offering the ability to have that done in another hospital. And it was amazing just to see, what was to me quite striking in the video was to see the difference between his face from being in pain, chronic, constant pain, to after his surgery where he just looked a lot brighter.
Yeah, no, brilliant. And our performance is reported every month for board, but we also talked about digital transformation and our digital strategy, and that's a really exciting piece of work. There's so much that can help people. People can order their prescriptions online, book appointments through the app. What do you think is important for our digital strategy and to help improve access for health and care?
So it's such an important a part of our future, how we deliver healthcare. So I always say you have to talk about our workforce and where we work, so the estates, and we have to talk about our digital. But specifically about digital, I always say, is it better for the patient? Is it better for the clinician? And is it better for the system? So can we tell that we're doing something better? But I think the most important thing is how do we make sure it's a better experience for the patient? So there's all sorts of digital aspects that can create a better access to healthcare, how you look after your diabetes, for example. And of course, artificial intelligence is going to become an increasingly big part of how we help look after people's care.
Brilliant, and today was just the start of that conversation. We'll bring back our digital strategy. We also talked about research, lots of things in our packed agenda, but I'll bring that to a close because I know we're going on to the next part of the board. So thank you very much for your time, Chris, today.
Pleasure.